Hello there and happy Tuesday. I'm excited to join you live because I have been learning so much these past couple of weeks and just wanted to share it with you. If we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of Reactive Therapy and Wellness here in the Los Angeles area. And I have been learning a lot from my colleagues and friends about dizziness and particularly vestibular migraine. This is something that has been so much better recognized in the last few years. And this is something that I think as a therapist, I definitely didn't recognize, and I've learned so much. And I just want to say hello to this beautiful brain who said they are joining from FND Hope Canada. And folks from Gainesville, Florida, I'm so glad you're here. Thank you for saying that in the comments. And it just makes me feel like we're hanging out. I appreciate that. So, thank you for joining because this is a hot topic and so important for therapists to understand. So today I want to share a little bit of an article that Jaimy and Katherine included in their recent webinar. They did a webinar for us. It was called the Otolith Mixtape, really about how to help complex dizziness in understanding the otolith and applying that to vestibular migraine. So I want to share one of the slides from this webinar where I kind of got the inspiration to read this article and talk about this. And this was where they highlighted some of the mechanisms that we're starting to understand in vestibular migraine. Many different pieces involved, but they really highlighted this altered processing. And this is where me as a therapist go, okay, there are many patients where I missed assessing this and treating it. And so, when you know better, you do better. And so I'm just constantly learning. And this is one of those pieces that I missed, was the altered processing component associated with vestibular migraine. What does that really mean? So that's where they had this quote, which you can kind of see at the bottom. It's teeny tiny. I don't even know if I can read it here, but many neuroimaging studies demonstrate that patients with vestibular migraine exhibit extensive brain dysfunction, particularly in sensorimotor integration. And when Katherine and Jaimy shared that in the webinar last week, I was like, this is really interesting. I want to know more because I am always so curious. And I know a lot of you are so curious, which is why you're here. So I dove into that article. So let me just share a little shot of that article. If you're on our newsletter, by the way, I will share this article in our newsletter this week. I always do. I always share our videos, our posts, things we're reading, and links to the article. This one is free, full text. It is from a group in China. Liu is the first author, and it's Effective Vestibular Rehabilitation on Spontaneous Brain Activity in Patients with Vestibular Migraine, a Resting State Functional Magnetic Resonance Imaging Study. Now, I have to tell you, this is a very small study. I want to say it was 14 people. So this is a small study. Basically what they did is they did fMRI studies both before and after vestibular rehabilitation. Now, of course, my dogs can you see my dog right here? Always getting excited when I share anything on a live video, so I apologize. So they looked at resting state fMRI before and after vestibular rehabilitation. They also looked at dizziness handicap inventory and a couple of other measures to look at the effectiveness of vestibular rehabilitation. They did the vestibular rehab for a month. And I will tell you, the vestibular rehab that they did is probably exactly what I was doing as a new grad, doing vestibular rehab. And I'm not saying that's a bad thing, but there is more that we should be doing. So in this study, and my take homes from the study was not what they did, but I do need to tell you, of course, what they did, which is they incorporated a bit of autonomic training with breath work. Yay. So definitely should be included in vestibular rehab for vestibular migraine. But then they basically did VOR training. Really great thing if there is VOR dysfunction. My experience now, and especially since I've met Jaimy and Katherine, is that the vestibular dysfunction with vestibular migraine is way beyond VOR. So VOR, vestibular ocular reflex, I'm turning my head because it provides the gaze stability as we turn our heads. And it is well known, and it's common that there is some dysfunction and dizziness caused by that with people with vestibular migraine. But there's much more than that. And that is where, let me come back to what Jaimy and Katherine shared. There's so many pieces. So they actually did not go into all of the pieces on here in the Otolith webinar because it was just an hour. So we were just kind of giving the basics here, but in their positive spin course, they actually go through the altered processing, the hypersensitivity, the altered metabolic activity, altered functional connectivity, and inflammation components of vestibular migraine that we need to know and understand as therapists. But in this article, what they did find, which I found really interesting from a mechanistic standpoint, was this change in resting state activity on the fMRI. So this is the figure showing that it's in the left cerebellum. And what they actually found in the posterior cerebellum, by the way, they found that with vestibular rehab, this area was much more active. And so they proposed that a potential mechanism of vestibular rehabilitation was actually to activate and use this part of the cerebellum. We know from a lot of our neuroanatomy and neurophysiology that there are numerous connections between the cerebellum and the vestibular pathways and all of our postural responses and balance and all of the oculomotor control of our eyes, all of those great things. It's not really that surprising then that we would see this change in the left posterior cerebellum with vestibular rehab. And potentially this is kind of a mechanism of neuroplasticity, a mechanism of brain change when somebody undergoes therapy. And I think what's so important here, if I go back to, this slide from Jaimy and Katherine's webinar, is to then zoom out from the vestibular system a little bit in vestibular rehab, in treatment and assessment of vestibular migraine. We really should be looking at the person holistically, and we should really be looking beyond the VOR and at these potential other sensorimotor integration pieces in our testing. Now that would include, if we go beyond the VOR but still the vestibular system, the otolith. And so we've been talking about the otolith a whole lot in terms of assessment and treatment, and it highly pertains to vestibular migraine. The other piece, so otolith, the other piece is looking at the sensory systems, looking at how they're functioning, but more so how the brain is weighting the information coming in. Visual information, vestibular information, somatosensory information. Because if there's altered processing, if there's altered or changes in the integration of those, it'll be, the person's going to be dizzy. And that will be really hard to overcome and improve by just focusing on one system, just the vestibular system or just the VOR. And then the autonomic nervous system. And I've talked about this a little bit, and Jaimy and Katherine did a great job of talking about this as well, but we can use the sensory and autonomic nervous system assessment and treatment as an off switch for a person's dizziness. And so when I meet anybody who has dizziness, chronic dizziness, vestibular migraine, Meniere's disease, maladie debarquement, like 3PD, you name it, one of the things that I'm talking to them about is, are you working with your therapist on finding what works for you as an off switch or a dimmer switch on your symptoms? And these are usually some of those processing or integration pieces in the brain. Sensory, autonomic are big ones. And so what I love that Jaimy and Katherine shared was that they kind of zoomed out on vestibular migraine of a holistic view of what can be involved, and that those components should be a part of treatment. So there's so many light bulb moments when I listen to Jaimy and Katherine, and I listen to them a lot. So some of this stuff I've been incorporating for a while, but hearing it again, I was like, oh yes. So very, very good. So if you missed their webinar, by the way, we have it up for a week for people to watch. So July 18th, we'll still have it up and you can still watch it. It is, if you go to our website at reactiveeducation.com, it's the Otolith Mixtape. Let me see if I can get a picture of that. And then we have their, I'm going to try to pull this up. So excuse me for a second as I try to pull this up. We have their series of courses we have recorded and put into little bite-sized modules, their Positive Spin 1 course and their Positive Spin 2 course, and put it into a package bundle. It is a full 16 plus hours of learning that therapists can do at their own pace. And we put it on a flash sale for the next month. So if you're a therapist, if you know a therapist, I would send this to them and check it out. It's also on our website, reactiveeducation.com/positive spin series. But I'll put a link. There's a link in our bio on Instagram as well. But I'll share a link here on our stories. But this is the series of courses that really helped me deeply understand this complex sensory processing, perception of an upright integration, the Otolith, to really change my practice so that I could help people find an off switch and have people get very immediate results. And this is just a little side note. One of my main roles at Reactive is to meet with people for our programs, meaning if they've applied and they're interested in coming and working with us, I get to meet them. I love it. And often people ask, like, well, how quickly might I get better? And quite honestly, in a lot of our programs from day one, people are starting to get better. It doesn't mean they've recovered in one day, but there's something that is better. And a big reason that is, especially in dizziness, is because of the learning and mentorship and growth that our team has had with Jaimy and Katherine so that we can get immediate results with complex dizziness. So personally, I'm so thankful for them. I'm thankful for them teaching me this framework of dizziness dysfunction and a framework for approaching it. And thankful too that they've put together free resources, free webinars for you all to learn it, and the sale to get their favorite courses, my favorite courses. So this is through July 18th. By the way, if you're a student wanting to dive in, send me a message because all of this is 50% off for you. It always is. So if you're a student, there's always a sale. If you're a Brain Bites member, one of the members of our mentorship community, there's also a greater discount. So please, please, please email me, send me a message about that before you buy anything. But otherwise, if you're not on our email list, once again, I will share this free full text article. I'll share our videos this week. Get on our email list so that you can get that. If you're a therapist, join at reactiveeducation.com. If you're a person with a neurologic disorder, join at reactivept.com onto our newsletter, and we'll send this out on Monday. Thank you so much for joining me today. I always love to talk to you, hear from you. Continue to send messages and questions. I learn so much from you all. And I hope you have a wonderful day. I will catch you soon. Bye.